conversations with our community. So the title for this presentation is Clearing the Smoke, Helping You and Your Loved Ones Kick Tobacco, one day at a time. So we want to thank you for your time this afternoon. Next slide. So this is an agenda we're going to follow. This is a welcome that we're going to do. We want to welcome everybody for coming tonight. We will just keep you here for an hour, but we appreciate your time and effort in joining us tonight. We have actually two formal presentations. One going to be by Leah Brown. The other one's going to be by Megan Keith. And then we're going to have a patient's perspective that will tell you about his journey in him quitting smoking. Then we open it up for questions and answers. And so people have given us questions during the registration process. And so if you have additional questions throughout the presentation, feel free to put those questions in the chat and we'll try to get to them the best we can. If we run out of time, we'll get those answers to you after the event. And then lastly, we will have some additional resources and some upcoming events. Next slide. So the Duke Cancer Institute, we're the Office of Health Equity. Our vision is to be the leaders in reducing cancer health disparities. And we do that through community outreach and engagement partnerships. And so one of the things that we do is we have 4 different avenues that we look at how we're going to reduce these health disparities. One is community outreach and engagement. And this is what we're doing now. What we're doing right now is being able to reach out to the community, to be able to provide information, to answer questions, and to actually interact with you all. We have community-facing patient navigation services. So we know that we live in a very complex healthcare system, and it's not always easy to get access to the care that you need. So we have community-facing navigators that help individuals get access to the care that they need. And not only are we helping individuals who have health insurance, we also help individuals who do not have health insurance. And we do have a bilingual patient navigator for Spanish. Health disparities education, and some of this we'll cover tonight. Talk about, how some populations have a heavier burden of cancer over other populations. And then we also do clinical trials, education, and workplace diversity. And so it's very important that we have adequate representation of all patients in our clinical trials so that we make sure when therapies are developed, medications are developed, that is actually going to be able to be applicable to all populations. So we want to make sure that we teach people and help them understand the importance of being involved in research clinical trials. Next slide. And I'm going to turn this over to Mr. James Tabor.
Thank you very much, Dr. Moore. And let me just first of all, on behalf of the Men's Health Council, thank you for allowing me an opportunity to represent this group. One of the things that the Men's Health Council, first of all, recognizes that Durham is very much a large collaborative where institutions, governmental entities, health facilities come together to look at how we can make this community an even better place to live. The Men's Health Council was actually started in 2014, and we have to give a lot of credit to the Durham County Health Department for providing us the supports to really get off the ground when a small group of men came together, recognizing that there were health challenges in the community that we needed to just look at with a bit more attention. Those collaborations with institutions like Duke, UNC, and others have really provided us an excellent chance to reach out to men, to help connect them with resources, to inspire them to be role models, to be much more expressive in terms of how they can address their own needs. Our objective was also, and the focus I should mention, was clearly on men of color, recognizing that as we statistically look at the demographics of this country, that segment tends to be those who are most at risk. And when we look at problems or challenges as it relates to smoking, and there's been a long history of that in many communities, to include how, I have to say, communities of color have really, I think, been preyed upon, but that's I'm not going to dwell on that now. But the Men's Health Council is just glad to have an opportunity to be involved in this effort as we reach out to educate, to promote and model healthy lifestyles, and to just help men engage in more responsible decision-making activities. So again, this is a pleasure for the Men's Health Council to, as I said earlier, be part of this effort. I think that maybe my next challenge or charge is to introduce. Is that Miss Leah Brown? Leah Brown. I'm glad, Leah. I was just waiting for that picture to come up. But we have the opportunity to have someone who is going to be sharing some information with us that we really feel will be very much worth listening to. Leah Brown, as you will see, currently serves as the tobacco treatment specialist at the Durham County Department of Public Health. I should mention, as she had mentioned a little earlier, that she is a lady from Goldsboro. So Goldsboro's loss was obviously Durham's gain. Leah, we're very, very glad to have you here. And we're just looking at hearing your comments relative to this very, very relevant and timely topic this evening. So on behalf of all of us, we're glad you're with us.
Thank you so much for that introduction. Again, you guys, my name is Aaliyah Brown, and I'm the Tobacco Treatment Specialist for Durham County's Department of Public Health. And tonight we're going to be having a conversation on ways that you can support the smoker in your life on their journey to being smoke-free. Next slide, please. So when it comes to the dangers of tobacco, you've probably heard it all before, right? But the fact of the matter is that tobacco is costly. Cigarette smoking remains the leading cause of preventable disease and death in the United States, and it accounts for 80 to 90% of all lung cancer cases. The United States spends billions each year on smoking-related illnesses, and there's also environmental costs with hundreds of thousands of tobacco waste currently polluting our planet. And as a society, youth tobacco product use is steadily increasing, with e-cigarette use being the blame. Next slide. To make matters even worse, our communities are being targeted. I heard someone mention that earlier. There is a constant battle that smokers face when tobacco companies are spending billions of dollars each year to market their product to vulnerable groups. Big Tobacco not only targets these communities to start smoking, but also makes it harder for them to stop by promoting products that are more addictive. They target our youth by sponsoring up-and-coming artists and events that appeal to younger people and making products that look and taste like candy. Women are being targeted by using themes of social desirability and independence and infiltrating themselves into the women empowerment movement. And they target our African-American communities heavily by advertising menthol, cigarettes, and other flavored cigarillos, which are known to be more addictive and harder to quit. In the image I have here, this is just from a local store here in Durham. In the past 20 years or so, they've also hijacked the Pride movement for the LGBTQ plus community by attaching themselves to Pride-related events and publications, and this is just to name a few. Next slide, please. So for those who share a home or are dwelling with a current smoker who may be a little on the fence about having these hard conversations about being smoke-free, this impacts your health as well, as there is no risk-free level of secondhand smoke exposure, even briefly. Secondhand smoke exposure causes more than 7,000 deaths each year from lung cancer from those who don't even smoke. Next slide, please. And you may be thinking, if smokers know it's so bad, why can't they just stop it? Well, it's not that easy. Nicotine is the main addictive drug in tobacco that makes quitting so hard. So cigarettes are designed to rapidly deliver this nicotine to your brain, and inside your brain, nicotine is triggering the release of chemicals that make you feel good. And as nicotine sparks part of that brain over and over again, your brain starts to get used to having nicotine around. And this can make smokers not feel like themselves when they quit. And there goes to cravings and withdrawal symptoms that can impact your mood and make you feel irritated and sad and anxious. And triggers can come from any and everywhere, right? So it can come from routines, places, or even food that you like to eat. It's also common for smokers to have bigger appetites and slower metabolisms after quitting smoking, which can lead to overeating or weight gain, and it doesn't have to. Next slide, please. So just you being here tonight with us shows that you care about yourself or you care about someone else, and you are needed and you are essential to their success. Smokers who have a support system have higher intentions to quit. They can gain and maintain momentum. They have a higher chance of quitting for the long haul, as well as you as their support system, you can provide substitutions to triggers and distractions. So how can you help? So you can be of a great help by starting to learn your conversation style. So you can ask yourself, have you participated in smoking with them in the past, or has this been a cause of conflict before? Knowing how you communicate can definitely help frame this conversation. So you need to understand your personal style, which can help both you and the smoker in your life feel heard when having these conversations, especially one that can be really sensitive. So you can identify whether you are a passive communicator. So do you have an inability to say no? Or do you have a go with the flow type of attitude? Or when talking about their smoking, do you say things like, oh, I guess it doesn't matter that much? Or are you an aggressive communicator? Do you talk over the person? Do you have poor listening, or are you giving them ultimatums saying it's my way or the highway? I'm right and you're wrong. Are you passive aggressive? Do you explain their smoking in frequent sarcasm, or instead of being direct with the smoker saying, I hate the smell of cigarettes, or fine, that's fine with me, whatever. Those people who have passive aggressive communication styles can have difficulty acknowledging the emotions. Or are you an assertive communicator? Are you very direct with the person in your life saying, I feel disappointed every time I see you smoke? Do you have the ability to say no? And are you feeling confident expressing your needs and desires? Next slide, please. So when having these hard conversations, you should have an opening, right? If this is something that you've argued with about before, perhaps say something like, did you hear about the recent menthol ban? What are your thoughts on that? Or by saying, you are important to me. I want you to live a long, healthy life. Discuss your concerns. So you want to have an opening, right? And you want to also put the smoking in perspective to them. So explain some of the costs. Show them what your family could have spent with the money that they used on cigarettes, such as a vacation, or say how, oh, we always wanted this new couch. Perhaps if you start to cut back on the smoking, we'll have the money to afford it. Or you can discuss how the habit isolates them and even you from social situations that don't allow smoking. Or express that you want to live a long life with them in it, and you're concerned that their smoking won't make that possible. Also, ask open-ended questions. So these answers will kind of help you understand what the person is feeling. So these are not yes, no questions, but questions that can push the conversation forward. So what would make quitting easier? Or how can I support you? So we want to make sure we're having these conversations with the smoker with the solution in mind. So we want to ultimately move this forward. We don't want to stay stuck in conflict. Also, actively listen. So how good a listener are you? So resist the urge to comment and just reflect back on what they're telling you. Quitting is a highly personal decision that's extremely hard. And for many people, it's a process that sparks a lot of soul searching. So they may have to go back to seeing what started them to smoking in the first place. And you can help them with this. And also you want to help them find an aid. So again, we want to have a solution in mind. We want you to help them equip themselves with all type of resources and tools and tricks that'll make this successful. So here are some do's and don'ts. So don't ask if they've used tobacco today, and don't should on them. Like you should have did this or you should have did that. Don't complain if they're irritable while going through withdrawals, but do offer distraction. So plan tobacco-free activities, maybe suggest going to a movie or attending a game night with friends, or eating out, something that's smoke-free. So withdrawal can also make you very angry. So don't be so hard on them. Stay positive and try not to take it personally. Try saying things like, I know this is hard on you and I am proud of you for sticking with it. Do celebrate successes and goals. So recognize the success of staying tobacco free, even if it's only been for a few hours. We're going to celebrate the milestones that's designated by them because they determine what's a win. Also, don't be impatient. Most people quit many, many times, and it takes practice to be a good quitter. So try not to get frustrated and just be supportive of them when they are ready to try again. And also help them de-stress. So the stress of daily life is why most people smoke in the first place, and also how most people slip up when they're trying to quit. So suggest healthy ways to decompress, maybe some meditations or taking a walk, watching some of your favorite shows, or also creating a cravings care package. So this cravings care package can include gum, hard candy, toothpicks, healthy snacks, a stress ball, maybe some motivational messages or scriptures, and also maybe a reusable water bottle, something that they can keep in their hands. And most importantly, don't give up on them. So cravings can last weeks, even months. You can quit and then bring it back up maybe months or a year later, but you have to show them that you're there for the long haul and just continue offering support and celebrating successes because your support makes a huge difference. Next slide, please. So here are some resources that we have available. Of course, we're going to plug in the quit line. You can call 1-800-QUIT now, but they also have text services as well. And you can text ready to 200-400. They have smoke-free text, and they have this for all different groups. They have this for moms, teens. If you are a person who doesn't smoke, but you dip, they have that as well. The Truth Initiative also has a vaping text-based program that you can text Ditch Vape to 88709. We have Quit Start. We have a smoke-free women's Facebook page, Live Vape Free NC, and then also the American Lung Association and the American Cancer Society. Both have quit lines listed here available too. Next slide, please. So I just want to put in a shameless plug so that for those individuals who may be a little bit concerned about being under or uninsured, Quitline has 4 proactive quit coaching calls that's available for uninsured Medicaid and Medicare patients. You also get free nicotine replacement therapy. This includes lozenges or gum and a starter kit of nicotine packages. And they also have resources available for behavioral health for free. And so again, my name is Aaliyah Brown. I am with the Durham County Department of Public Health. Here's my contact information, and I will be here for questions towards the end. Thank you.
Thank you, Leah. Appreciate that. And we'll have those resources for you. And that was a great slide on the quit line. So so people will know we're gonna record this, so it'll be available to you. So I want to introduce Megan Keith, which is our next presenter. Megan is a licensed clinical social worker and tobacco treatment specialist here at Duke Smoking Cessation Program. She provides individual and group behavioral counseling to people using tobacco. Now, interesting, Megan is raised in a tobacco farming family and is passionate about supporting those affected by the nicotine addiction. And I can say, I know when I used to go into Winston-Salem, when you get right into the city limits, you start, even before you get there, you start smelling the tobacco that's being cured. So I imagine it's quite difficult trying to learn how to not let people and teach them not to use tobacco products in the farm that you grow up. So thank you, Megan, for being with us today.
Thank you, Dr. Moore. And we can go to the next slide. Thanks so much. And I'm just going to go over some of the things were covered beautifully by Aaliyah, so we won't spend too much time there. But just a little bit of information. 1 out of 5 people in North Carolina smoke, and 2 out of 3 current smokers will die from illness caused by smoking. So this is a big problem. This is why there's such a push to get people to quit or reduce their tobacco use, because it's just so dangerous. The important Other things to note on this slide is that 1 out of 2 smokers tried to quit last year, and the average smoker has 7 or more unsuccessful attempts before they successfully quit. So anything we can do to move the needle towards quitting for good is going to be helpful, because most people who smoke at this point, they want to quit. They have tried to quit. They're looking for resources because they know the dangers. So my role here at Duke and the role of other people who are working in the tobacco space is to make that process of quitting as smooth as possible. Next slide. So, most people, again, know the dangers of tobacco use. This is just a quick little rundown, but you can see that pretty much every system in your body is affected by smoking. Tobacco use is extremely dangerous and causes so many health problems, many types of cancer, many problems with the lungs, many problems with the heart, many problems with the eyes, problems during pregnancy, diabetes, the list goes on. And this isn't everything. This is a brief snapshot of the dangers of tobacco use. Next slide. And, another thing to just really highlight is that the health benefits begin right away when you stop smoking. So any smoke-free time that you get is going to benefit your body. Within minutes, your heart rate drops. Within 24 hours, your nicotine level in your blood drops to 0. Carbon monoxide levels start to come down in several days. So right away, you're seeing benefits from quitting. And those benefits just continue to add up as that time adds up. So the more time that you have quit, the better off you are. Next slide. So a lot of times that, working as a tobacco treatment specialist, I am helping people every day who are working on quitting or reducing their tobacco use. And I get this question all the time, is this an addiction or is it a habit? A lot of people like to label their smoking as a habit versus an addiction, but really both things are at play. So there is a nicotine addiction that's happening. Nicotine replaces our natural brain signals. And when a smoker stops smoking, their brain has to adjust. So that's why there is a withdrawal period when you're coming off of nicotine that's really uncomfortable. All of those withdrawal symptoms that Aaliyah mentioned, irritability, hunger, short fuse, just a lot of anxiety, depression, edginess, all of those things go along with the nicotine withdrawal. So that's part of the picture. And then the other part is there is a habit component to smoking. Smoking is paired with everything that you do. Waking up, eating, talking on the phone, work breaks, spending time with friends, being bored. So there is, because smoking is so highly practiced, you have to change your habits in addition to breaking the nicotine addiction. Next slide. So what are some of the challenges? And again, Aaliyah went over these challenges too, but many people who smoke suffer from high levels of stress, anxiety, and depression. And these challenges are big predictors of relapse. So anyone who deals with a very stressful job, a lot of anxiety or depression, they are more likely to go back to smoking once they are able to quit or have shorter periods of time that they're able to quit. And then in addition to those stressors, a lot of people are concerned about the cost when they're trying to quit smoking. So this is the importance of the quit line, other free services, because there are lower cost alternatives. If you just go to the store and look at the medications like nicotine patches, nicotine gum, it can be pricey. Sometimes the prescription medications aren't covered, but there are resources for those who are interested in quitting. Next slide. So just some additional challenges to quitting: high dependence. Some people smoke a lot of cigarettes. There seems to be some genetic component that is not well understood to the level of dependence that people have. Again, high stress, anxiety, and an important other thing to mention here is alcohol and drug use. So for people who drink alcohol, 85% of smoking relapses occur while drinking alcohol. Again, weight gain can be a really big predictor of relapse as well, poor support and financial challenges. So there are a lot of things that get in the way, a lot of barriers when people are trying to quit. Next slide. So in light of all those barriers, what do we do to smooth the way for people as they're quitting? So we have a two-pronged approach. And the first prong is the medical management. So we use medications to help people with quitting. Nicotine patch, immediate release nicotine products. Together, those are called combination nicotine replacement. So you use the patch, which is long acting, with an immediate release product like nicotine gum or nicotine lozenge. And together that works really well to manage cravings. There are also prescription medications called varenicline, which is also known as Chantix, and bupropion, which is also known as Wellbutrin or Zyban. And those last two medications do have to be prescribed by a doctor. As well as the nicotine inhaler or the nicotine nasal spray. Nicotine patch, gum, and lozenge are over-the-counter products that you do not need a prescription for. Next slide. So the other prong of the best, most effective approach is behavioral treatment. So group therapy and individual therapy, Quitline services, smokefree.gov has an app. So, with the Duke program that I work for, we offer the group therapy and the individual therapy. So it's either working as part of a group of people, usually about 8 to 10 people who are all working on quitting together, or you can have individual therapy one-on-one with a licensed clinical social worker who's going to really tailor those services to your unique challenges as you're trying to quit. Again, another plug for the North Carolina Quitline. This is a wonderful, wonderful service. They offer behavioral support and coaching as well as the medication, as Aaliyah mentioned earlier. Next slide. So I would be remiss if I didn't mention e-cigarettes, and I know that a lot of people are looking at e-cigarettes sometimes with suspicion and sometimes hopefully that maybe e-cigarettes could be the answer to quitting smoking. So toxins in smoke are what cause cancer, heart attacks, lung disease, all of those health problems that we talked about earlier. Nicotine is what causes addiction, but nicotine does not cause the diseases that are associated with smoking. So e-cigarettes contain nicotine, but they do not contain smoke. So this is where a lot of people think, well, these e-cigarettes are safe. It's something that I should use. But really, the truth is that we just don't know the long-term effects of e-cigarettes. So we can't say one way or the other how safe these products are. And there has been a lot of talk about the regulation around e-cigarettes, and that there has not been a great amount of regulation around these products, and it's possible to get unregulated products, unregulated vaping products at this point, although that is starting to change. But what we look at in our program is that e-cigarettes tend to create a situation where people become dual users. So people tend to use combustible cigarettes or regular cigarettes along with e-cigarettes. So their nicotine consumption actually goes up rather than going down, and they are furthering the addiction process in that way. We also find that it's harder to stop using e-cigarettes because they tend to be used differently than regular cigarettes. So in general, if you want to totally quit, e-cigarettes are not the best choice. The best choice is using those FDA-approved stop smoking products. So using the medications that I mentioned in an earlier slide, and then doing the behavioral treatment along with those medications. That's going to give you your absolute best chance of being successful with quitting. Next slide. So I just wanted to say thank you to everyone for your time and attention. I know I went through those slides pretty quickly, but I am always available and happy to answer questions. And I'll be available at the end as well if anything comes up. Thank you.
My responsibility is to introduce to you an individual who is one of the pioneering members of the Men's Health Council, very actively engaged in a number of community affairs to include those are health specific. I've known Bradley for a number of years, and I found that any activity he undertakes, he pursues with a great deal of zest and enthusiasm with a primary objective of just trying to make the lives of those who he has the good fortune of touching better. He is going to share with our perspective as it relates to his smoking cessation journey. And I'm sure he's going to be making some comments that we'd all be very much interested in hearing. So Bradley, if you would, please.
Thank you, James, for that introduction. I guess I can start out by saying I started smoking as a teenager. So it was very easy for me to smoke because my father and two brothers worked at Liggett Myers. So if any of you old enough, you know what Liggett Myers was, a tobacco company here in the city. So it's very easy for me to get cigarettes when I was younger. And as I grew into my teens, it became something that I did on a daily basis. I was never a really heavy smoker, but I did smoke. For me, smoking after I ate or after I drank was really something that I needed to do. So I guess I smoked for years until I was maybe about in my 40s, maybe late 40s. So I tried to stop several times. We had some kind of stop smoking clinic at work. A few times, you know, they offered money, $100, so and so. So I didn't make I made the choice to stop smoking once it became $500. So my company offered anybody in the company that wanted to stop smoking $500. So we went through a program. So we had to go through a program to stop smoking. And I did the requirements. We had to go through some kind of courses, you know, we had people to come in and talk to us about smoking and, you know, did things to help us to quit smoking. I found it not very difficult. I'm one of those people, once I start something, I put my mind to it, I can do it. So the stop smoking was easier once I decided I was going to do it. You know, I have problems kind of starting stuff. So once I start, I'm in it. But once I stopped smoking, I smelled everything. Usually I could not smell people that smoked around me. So I could smell anytime I was around people that smoke, it was automatic. Those people or that smell automatically stunk to me. I could taste food much better. And so smoking, I would always spray cologne on after I finished smoking because I didn't really want people to know I smoked, or I didn't want that smoking smell on me when I walked around people. But once you stop smoking, your whole sense of everything starts to change. You can smell better, eat, you know, your food tastes better, and things of that nature. Is there anything else I want to say? I think that's about all I want to say about the smoking. And if anybody have any questions for me, I will be around.
Thank you very much, Bradley, for giving us your perspective. Next slide. I just want to let you all know on the 20th of November, the Men's Health Council, along with the Office of Health Equity, Durham Department of Public Health, we had a lung cancer awareness walk. And so we took this time to talk about some of the risk factors for smoking. We provided some resources for individuals that was there. And of course, we did what we could to exercise, get healthy, you know, and help expand our lungs, because we know exercise is very important, getting fresh air. So that was one activity that we did in November to bring about awareness for lung cancer awareness. Next slide. So before we go to resources, I know a lot of resources was covered. I just want to let you all know that if there's individuals who have a history of smoking, the guidelines for screening for lung cancer has changed over the last year. So if you are an individual in the age of 50 to 80. And we want to emphasize 50 because the previous guidelines said 55. So if you're 50 years old and you have a 20-pack year history of smoking, and what a 20-pack year history of smoking means is if you've smoked 1 pack a day for 20 years, or you smoke 2 packs a day for 10 years, and you have quit smoking within the last 15 years, or you currently smoke, you're at high risk for developing lung cancer. So we want you to go to your primary care provider and tell them about your smoking history and tell them that you need to be screened for lung cancer. Because we know that, and one of the reasons why lung cancer screening was changed, because has such a poor outcome. And individuals are normally diagnosed in the later stages. And so by changing the screening guidelines, where we screen people sooner, we're able to catch lung cancer at a much earlier stage so we can have better outcomes. So I just want to make sure I highlight that. So now we're going to go to a little bit of questions and answers. We have some individuals that was able to provide us some questions, and Aaliyah and Megan did an excellent job in providing some great information. And so the first question I'll ask, I know Megan talked about it, related to mental health services that are available when you try to stop smoking. And so could you give us a little bit more information about what type of mental health services are available at Duke, and what type of services are available at Quitline? And is there a cost associated with these services? And how long can they get these services, even if it's for free for Quitline? And either one of y'all can answer this.
So I'll go first to answer for Duke. So with our program, it depends which route you go, what the cost is. So we offer the individual counseling options and we offer our group counseling options. Individual is billed to your mental health insurance benefits, which may be different from your medical benefits. So we verify that ahead of time for our patients if they want to do individual counseling, and we would let them know any copay costs associated with that. Our group is free of charge. That is covered by a generous donation from some of our sponsors. The group is offered about every 2 to 3 months, and it's a set 8-week course. So we do have, a little bit of a gap between getting groups started, but the individual is always available.
Thank you.
Yes, and I'll also add in for the Quitline resources surrounding behavioral health. So whenever you sign up for Quitline services, they have a questionnaire through their web coaching. And once you answer yes to any of those, do you currently have any mental health conditions? You don't have to specify what, and you also don't need a formal diagnosis for this. You get 7 scheduled calls and 12 weeks of combination nicotine replacement therapy. So, and you also can talk to a quit coach specifically trained in behavioral health, and that is free.
Thank you. I appreciate that. James, do you have a question for the panel?
I do. I was interested in the comments earlier as it relates to secondhand smoking and the effect that can have on other people in the household, children especially, who may not be smokers. Is that kind of a potential setup for kids to become perhaps more likely to be smokers because of that exposure, as well as the negative health benefits of it? So if someone could comment, I would like to hear a bit more.
Sure, I'll go first. If Megan wants to add in after, and your assumption would be correct. So that early exposure to smoking can lead to smoking as an adult. Most people who are long-term smokers begin smoking when they're in their teens or even earlier. So we do want to reduce as much exposure as possible. And also, like I briefly mentioned before, exposure to secondhand smoke, no matter how small, can lead to, if not more, chronic health conditions from even the person who's a smoker, because the person who's smoking is using a filter. So sometimes secondhand smoke can be more dangerous to those that are in the home with them. If Megan wants to add anything, I'm sorry.
No, that was a great answer. I think you got it, Aaliyah.
Dr. Moore, could I ask just one other question, please?
Oh, go right ahead, James.
This comment about menthol and how it tends to make smoking a more pleasant experience, and the fact that that seems to be, as the slide showed earlier, targeted a lot to communities of color. And it seems that even we try to run from it, we can't hide because it's just hitting us and slamming us all the time. Comment about the menthol and why tobacco industries seem to be focusing so much on certain communities more than others.
I can add just a little bit to that. So the menthol does make it more addictive. So menthol is basically giving you a cooling effect. So it's serving as a mask for the dangerous effects that it's having on you. So for the smoker, it feels like I'm breathing better, I'm taking it in better, but it's just covering up the nicotine so it can get more to you. It also makes it harder to quit, and it's very, very addictive. And again, I mentioned it briefly, but they target all vulnerable communities. So African Americans, Hispanic communities. They target some of our Native American populations with things like native spirit, or utilizing cultural terms to make it seem as though this is a safe product, which none of the products are safe. And so they target these communities so that they can continue to use them and they can continue to be addicted to it. And it's a really big industry, and they spend millions getting our family and friends hooked. So yes.
Thank you.
So you brought up some great points. We said that, the menthol make us feel good. The nicotine is addictive. So you have something that's addictive, that make you feel good, that's killing you. That's a lot of barriers for people to overcome. And you talked about secondhand smoke and how if you expose to secondhand smoke as a child, it makes you at higher risk for being a smoker yourself. And Bradley kind of talked about that. And so Bradley, as you was in your early teens, let's say your early 20s, as you was making a decision to try to stop smoking or not, what type of peer pressure you had that maybe prevented you or helped you to continue smoking or to stop smoking?
Well, a lot of my friends smoked. So, it was very easy. I wasn't thinking about quitting smoking at that age because most of my friends smoked. And for me, it was very easy to get cigarettes. Just like I say, since my father worked at Liggett and my brothers worked at Liggett, they all smoked. So it was very easy for me to smoke. So stopping wasn't a question for me at that age. I thought I could live forever. So, I heard people talk about your lungs and things that cigarette smoking did to you, but it was never a concern at that age.
Thank you. And one of the questions we had in the chat was that, if nicotine is toxic, why does the FDA continue to allow it to take place? Could you touch on that, maybe, Megan?
Sure. So, and I alluded to this in one of the slides that folks may have seen. Nicotine itself is not toxic, so that is the problem here. Nicotine is what makes these substances addictive, but it's not the harmful part of smoking. So the harm is coming from all the other chemicals and compounds that are in the cigarettes. The nicotine is what is keeping you hooked. And that's why nicotine replacement products are a good aid to quitting, because they give you just that nicotine in a very safe form so that you can start weaning off of the nicotine in a way that's more comfortable than just trying to quit cold turkey.
And so the menthol for me was just like much better than the non-menthol cigarettes. So I do get when people talk about the menthol, because it does have that cool, calming effect, and that was much more entertaining for me than the non-menthol cigarettes.
Excellent, thank you. James, you have a question?
I was just thinking about an old commercial back in the day about the Marlboro Man and how that was really viewed as a I don't want to say as a strong, I don't want to say a man's cigarette because women smoke too, but that was just a strong smoker's type of cigarette. And if Aaliyah or Megan could just kind of comment on what was unique about those attributes of the Marlboro that tended to draw people as it did, but also causing so much reported illness and cancer and lung problems and all.
Yeah, so a lot of it was marketing, is strategic marketing, and you had the right idea. That's exactly the image that they wanted to portray about the Marlboro Man. And on the other end of that, Virginia Slims was marketed to women as,
Women,
like a healthier version, and it's cool and it's sleek, and you're being independent. You have your cigarettes, and they have their Marlboro Man. And so it's just strategic tobacco marketing. It doesn't matter which way you were consuming it, those cigarettes were dangerous. And so they just utilize images and marketing techniques and wording surrounding these certain communities to make it a little bit more palatable.
Yes, thank you.
And we have another question in the chat. I know we've been talking about cigarette smoking. What about the use of marijuana? Has that come up as far as the same dangers as smoking cigarettes?
So I'll speak a little bit to this. There is not the research on marijuana smoke that there is on cigarette smoke. The reason for that is because marijuana is at this time an illegal substance federally and in most of the US. So it is very difficult to get good, reliable research. So the answer is we don't have a lot of information about those dangers. Anytime you're inhaling smoke into the lungs, that is a danger, right? So we know that without a doubt. What we don't know are the specific links between marijuana smoke and then outcomes like lung cancer, heart disease, the things that we know absolutely about cigarettes. So the one thing I will say is that when you are using marijuana, especially if you're smoking marijuana, that's going to be a trigger for smoking cigarettes for a lot of people. A lot of people are dual users of these products, and so they sort of reinforce each other. So if you're trying to quit smoking cigarettes, it's a good idea to also refrain from using marijuana during that time.
And I will also add that smoking marijuana for males decreases their sperm count, so it can cause infertility problems later on in life. Excellent. We do have another question in the chat. I know that during the pandemic, people were in the house, there was really stress. Have you all seen a change or a increase in individuals having a difficult time quitting or smoking rates increasing during this time?
So I'll speak anecdotally from my program. We've actually seen a extremely dramatic increase in people seeking services from us. So people trying to quit smoking during the pandemic. And we don't have concrete data on why this is, but a lot of our theories are that people have time. So people are at home, they have the time to work on it. people are really concerned about their lung health because COVID-19 is a respiratory illness. So we have actually seen a big jump in people accessing services and working on quitting. But it is a big stressor. We're all going through a stressful time, so that does make it more difficult to quit, which is it's a really good idea for people to use the most effective forms of treatment. So again, doing those medications and the behavioral health treatments together to give you the best chance of quitting during these stressful times. So you can really target coping strategies, you can target the withdrawal symptoms and do all of it at the same time.
So if folks start quit smoking, you say you saw an increase of people wanting to quit smoking. Did that increase, or do you know the drinking or smoking weed? Because I think smoking weed and drinking became a very big factor during the COVID-19 pandemic, and people were at home a lot.
Yeah, I don't have specific data on that, unfortunately, but again, just by people's reports, I think those things did increase, but I can't say for sure.
Excellent. And James, I think we have time for one more question.
Yeah, if I may, Dr. Moore, this thing as it relates to secondhand smoking, I was looking at some statistics which indicated that African American children and adults are more likely to be exposed to secondhand smoke than any other racial group. And the implications of that, in one sense, we're talking about trying to encourage folks to stop. And those who have not yet started, the young kids, the other adults in the home, who may not have been by choice thinking about it, are being kind of unknowingly pulled into it. And that just kind of hangs on my mind in terms of a targeted population of smokers that's being created, not even knowing now that that's what they may likely become in time because of this exposure. So that's
People
more
don't really
a question. So what? I'm sorry, Brad.
People don't pay attention to the marketing. Marketing has become very subtle, and a lot of stuff you look at on TV. Kids do a lot of video gaming. There's a lot of subtle stuff in the commercials and the games that are being exposed now. So you have to really pay attention to what's being said, what's being thrown out there.
Yeah, do we have reason to feel that ultimately things will get better? That the statistics will drop?
Nope.
No? I hear Leah saying yes.
As long as companies can make money, they're gonna, no.
I like to remain hopeful. I do know that there is a menthol ban. They have not detailed how this ban will be played out as of yet, but that is a win for us, especially in the African American community where we have historically been targeted in our publications and our music and our media to not only smoke, but become smokers early. Because I don't know if you all know, but African Americans, we smoke later than our white counterparts, but when we do smoke, we are dying faster. So I know someone put in the chat, how can we fight back? We can fight back by knowing and letting our loved ones know that when you participate in smoking, that you are participating in systematic racism, and you are also participating in systematic media targeting. And so they are coming after our youth. I don't know if you guys are noticing with flavorings and even putting advertisement at eye level for children. So just knowing that this is the system that we are operating in, you're already getting the battle rolling. And I think that it will be a really good time to educate those around you who may be a smoker.
But now you have no vape shops in every community. Vape shops are becoming very popular in strip malls and everywhere now. So I mean, how can we combat that? Because that is a real subtle way of getting people to smoke. You know, people not looking at it that way.
Yeah. I know, Leah, I had to come off mute just to echo what you just said about what many people rather are allowing to happen in their community, which is more destructive than constructive. So it's point well made, well made.
Well, I just want to thank all of our panelists, Aaliyah Brown, Megan Keith, and Bradley Long for such a great, rich presentation. And the questions and answer period, I think, was really awesome. And it kind of brought all of this together, even through Bradley's journey. You know, we saw a lot of the things that Megan and Leah talked about. Bradley talked about his experience. And so even though it was years ago where he started smoking and the amount of time that he used to quit, we see all those things still in place. And unfortunately, those things still exist. And so we really need to work hard to make sure that, you know, we're trying to combat, you know, individuals starting to smoke at a younger age, because we know the younger you start, the harder it's going to be to stop, you know. So because your life is going to revolve around that particular activity and event. And so thank you again for your time. Thank Mr. James Taburn for helping me moderate this program. And I want to thank Kirsten for help putting things together. Especially want to thank the Durham Department of Public Health and the Men's Health Council of Durham County for all of the work that you all have done to put this program together. Again, we just want to thank you for your time. And even if you're not a smoker, if you know somebody in your family, your friends that smoke, hopefully you can utilize this information to help them. And we have a lot of resources. We are taping this session. Once we get it edited, if you would like a copy, if you just put your name in the chat, and we'll try to get a copy to you so you can share with your family members. I just want to thank everybody and have a great evening.
Thanks, you too.
Bye, everyone.
Bye-bye.